Today, I'm joined by Dr. Raina Gupta. Dr. Gupta is a fellowship-trained, board-certified sleep medicine specialist and a board-certified neurologist. She's the founder of Sleepology Health and Wellness in Chicago, Illinois. She's passionate about helping people optimize their sleep to enjoy better health and quality of life. With over 15 years of experience treating patients with a variety of sleep disorders, Dr. Gupta is a leader in the field of sleep medicine. She has served roles as a medical director for a sleep service line, medical director for a hospital-based sleep center, a clinical neurologist, and sleep medicine specialist, and an entrepreneur. She's also working on research studies with Northwestern University. Her research has been focused on children and parents with diverse sleep issues. Dr. Gupta is a fellow of the American Academy of Sleep Medicine and a member of the Illinois Sleep Society. She has a passion for raising awareness of sleep disorders, and she also speaks community groups and on podcasts frequently. So I'm excited for this conversation today on women's sleep health with Dr. Raina Gupta. All right, welcome. Today, I'm joined by Dr. Raina Gupta, who is the founder of Sleepology, which is a sleep clinic in Chicago. Dr. Gupta is a sleep specialist, and today we're going to be talking all about women's sleep health. I'm Dr. Nishu Gopal. I'm a physician specializing in integrative psychiatry and sleep medicine. This channel is all about sleep education for physicians and therapists. So go ahead and subscribe to this channel if you're interested in learning more about how to help your patients with sleep. And then also click the like button if this type of information is helpful for you, because doing so is going to get these videos and this information out to more healthcare practitioners so we can all support our patients with the power of restorative sleep. So before we jump in, Dr. Raina and I are going to be doing a sleep summit for women, along with several of our colleagues. There's 8 of us. So Dr. Raina, can you tell us a little bit about the sleep summit?
Yes, hi. Thanks so much for having me here. We are very excited for this upcoming sleep summit. So yeah, just like Dr. Bhopal said, we have 8 sleep specialists, and we have long recognized that women's sleep is a very needed and underserved kind of area of discussion. So our goal is to open up an opportunity for all women to better understand their sleep and the concerns around their sleep.
Fantastic. And so our summit is called The Power of Rest. It is a sleep summit for women. It's happening March 4th and 5th online. It's free. And we'll put the link to register on the screen here and then also in the video description below. So today we're talking about women's sleep health. And one of the reasons we're so interested in this topic for our summit and just for this discussion today is because women are underserved when it comes to sleep medicine. I think a lot of the studies are done in men, and women are often misdiagnosed in, when it comes to sleep, or they're underdiagnosed. So let's talk a little bit about the prevalence of sleep issues in women. So could you tell us a little bit about how common sleep issues are in women?
Yes. So we know that less than 66% of women get, on average, 7 to 9 hours of sleep. We also know that women need more sleep than men, on average 30 minutes more sleep. We may not be getting that. We all know that. Women also have poor overall sleep as compared to men. More than 1 in 4 women in the United States experiences insomnia or difficulty falling asleep or staying asleep. Women are also 40% more likely to have insomnia as compared to men. Insomnia is more common in people with depression or anxiety, and those disorders are also more common in women as compared to men. We know that during pregnancy, 50% of women experience insomnia, and in postmenopausal women, the prevalence of insomnia complaints is between 61 and 83%, as measured in an in-lab sleep study. Restless leg syndrome is also twice as likely to occur in women than men. And 80% of patients that have restless leg syndrome also have periodic limb movement disorder, which is involuntary leg movements that can disturb sleep at night. Also, 66 to 94% of women experience some form of change in their sleep during pregnancy. And women are also more likely to take naps as compared to men.
So those are pretty astounding statistics. There's a lot of different ways that women can experience sleep difficulties, as you just listed out. And as you said, many of these issues are more common in women. But the unfortunate thing is that many healthcare practitioners, even physicians, don't get a lot of training in recognizing these issues and supporting their patients with these issues. So I think it's really important that physicians and healthcare practitioners understand kind of the background information when it comes to women and sleep. So you just listed out all these different things that women have that are more common than men when it comes to sleep disorders and sleep issues, sleep challenges. Why do you think that is? Why do women have more sleep issues than men?
Yeah, so there's so many unique factors that make women's sleep different than men's. Of course, there are hormonal factors, and we know that the menstrual cycle, the premenstrual complaints, pregnancy, menopause, perimenopause, all can alter women's circadian rhythms and have impact on our sleep quality. Factors also in women related to responsibilities like social, work responsibilities, family, domestic responsibilities can impact sleep or can also lead to sleep deprivation. Women are primarily caretakers or often caretakers in the family, and this can only contribute potentially to sleep quality issues. There was a study by Duke University in 2008 that found that women who reported unhealthy sleep had greater psychosocial distress as compared to men. And this can potentially elevate the risk of heart disease, type 2 diabetes, depression, and mood disorders.
So that's really impressive, that statistic, that women have more daytime issues from sleep disorders and are more likely to develop physical health conditions like cardiovascular conditions and then anxiety and depression, which is important because there's a bidirectional relationship between mental health and sleep. So if they have more anxiety and depression, then they're also more likely to have sleep issues. And we know that just from a mental health perspective, being a psychiatrist, when we have patients who have depression or anxiety that's treated, if they start to develop sleep issues or their sleep issue, they have a new sleep issue, then they're more likely to relapse and experience depression and anxiety again, and it becomes this vicious cycle.
Yes, and a lot of our patients, of course, have both symptoms or have multiple symptoms. And so the way they present to us might be more anxiety, depression, but when you tease it out, you find sleep issues and vice versa. So I think it's really important to always be aware of the impact and in the vicious cycle that is created from both, and something to ask your patients about. How's your sleep when they present with mood disorder or concerns related to mood disorder?
Absolutely. Yeah. And then I guess the same goes for other physical health issues, medical issues, hypertension, patients with cardiovascular disease, and so forth. And I suppose you see a lot of those patients in your practice.
Yeah, we see patients with anything. There's so much overlap in sleep with other health concerns or other organ systems.
Yeah. So, since medical issues and mental health issues are so intertwined with sleep and vice versa, I suppose you would see a lot of that in your clinic. So can you tell us a little bit about that?
Sure. Yeah. We see patients with all different kinds of medical issues. And at times the sleep complaints kind of come to the surface and at times they don't. We know that we already talked about the prevalence of so many different sleep disorders in women. And I want to talk a little bit about what's more common in women as compared to men. So we talked about insomnia. We talked about restless leg syndrome. Because periodic limb movement disorder is so common in restless leg syndrome, it's also more common in women. And then we know that obstructive sleep apnea incidence increases after menopause as compared to premenopause, where men have more obstructive sleep apnea than women. Also, we already talked about depression and mental health some, but we know that depression in women is linked to 4-time increase in frequency of complaints of poor sleep quality. So as a provider, this is something that may show up as depression or may show up as mental health. It's just important to screen for sleep as well. We know that conditions that cause chronic pain can impact sleep and lead to insomnia, and these are frequently more common in women, including migraine headaches, including heartburn, arthritis, and fibromyalgia. Other sleep disorders that are common in women and that we see frequently would be idiopathic hypersomnia and narcolepsy.
So lots of different sleep disorders there. And I always like to ask during lectures and things, how many sleep disorders do healthcare practitioners know about, or how many do they think there are? And it's interesting when you get those answers, because there are over 80 different sleep disorders that have been defined by the ICSD, the International Classification of Sleep Disorders. I think there's 83 currently with the current edition, but there are some that are more common in women that you just listed out. So I'm curious as well, we've been talking about the prevalence of sleep issues in women, how women are underserved when it comes to sleep research and also clinical sleep practice. So how do these sleep issues show up differently than they do in men? Do they show up differently, or what are some things to look out for?
Sure, yeah, they do frequently show up differently in women as they do in men. So women are more likely to complain of daytime quality of life changes, so daytime sleepiness or fatigue, as opposed to men are more likely to complain of frequent awakenings or poor sleep quality. So that's like a major thing to know about when you're asking questions to your patients regarding sleep. Women also may not have classic sleep apnea symptoms that are frequently seen in men, like choking and gasping, snoring, or there may be no partner or family member that's observing it. So the patient themselves, either gender or any gender, may not really have enough awareness about what's happening during their sleep. We have patients that frequently would show up after going on family trips or trips with their friends, and somebody complains enough about, hey, there's something going on in your sleep, and that's when they finally come to see the sleep doc. So a lot of patients don't have enough awareness of their own sleep or any way to observe their own sleep, but they do know that they feel tired or they have poor concentration or poor quality of life, and that's sort of the way in which they show up at the doctor's office. Yeah, I had a patient recently who complained of waking up frequently, like every 2 hours at night. And what it turned out to be is sleep apnea, but the patient didn't know that, didn't have the awareness, and they felt so sleepy that they were falling asleep driving. So I think having the idea of the subtle differences between men and women can only help us when we screen or ask questions to our patients.
That's really helpful. And that reminds me of a patient I actually just saw today who is experiencing a lot of daytime fatigue, daytime sleepiness, and her bed partner doesn't complain that she snores or wakes up gasping or anything like that, those classic sleep apnea symptoms that we think of, especially, the overweight male with the thick neck, with the loud snoring. She didn't fit that picture, but we had talked before about, okay, maybe we should do a sleep study, see what's going on. And her primary care physician said, no, you don't have sleep apnea. You don't have those symptoms. So I think it's important as healthcare practitioners that we recognize that the symptoms could show up very differently in women. And just because they don't have those classic symptoms that we think of, it doesn't mean they can't have sleep apnea or some other sleep disorder.
Definitely.
So along those lines, what kinds of questions should physicians be asking their patients, or therapists too? What should they be asking their female patients when they're assessing for sleep issues?
Yeah, so we really need to hone in on women's symptoms during the day. So how do you feel? Are you sleepy? Are you tired? How's your concentration? How's your energy? Are there any naps during the day? What's the sleep routine? What's the sleep schedule? What do you do before going to sleep? What happens when you wake up in the middle of the night? How long are you awake? If so, tell us about your bedroom. Tell us about the light, the temperature, the sound. Are any of those impacting you or your sleep? Ask them about any naps during the day. Ask them about discomfort in the legs or other symptoms, other chronic pain or other things that could be impacting their sleep quality. Consider asking your patients to keep a sleep diary, to keep their sleep pattern, because on the spot, it's not that easy to give symptoms of sleep if something's been occurring off and on or intermittently. It's a little hard for patients to sort of follow that. So sleep diary is an easy way to get better data about someone's sleep, at least over a period of time.
So that's really helpful. And I love using sleep diaries in my practice as well. And one of the ones that I like, that I recommend to other physicians out there who are listening, is the AASM sleep diary. It's the American Academy of Sleep Medicine sleep diary. It's a free PDF that you can download, and it's really easy. My patients like it. It's like a 2-week grid. It's just a 1-pager, and it gives you a really nice visual when they fill it out of what their sleep patterns look like. So that can give you a lot of data. The other thing that I like to do, which is kind of like emerged from the pandemic, is that now that we're seeing patients on, or at least I'm seeing patients on telemedicine, on Zoom, they can actually show me their bedroom. Especially if they're taking their appointment from home, but they can turn the camera around and show me what their bedroom setup looks like. And I've actually gotten a lot of really interesting information from that and been able to give them just guidance on how to better set up their environment to be conducive to sleep. And we were just talking about that before this video, before we started recording, that like you live in Chicago. I used to live in Chicago. I used to live in the city as well. And the noise and the light and all of that is really disruptive to sleep.
Of course. And definitely something that people don't think about until you just move here. And then you notice that there's so many, street lights and so many sounds and so many trucks or people talking. It's important to be aware of what's happening in the bedroom environment during sleep and ask your patients about that so that they can identify issues and concerns so that they can use a sleep mask or use earplugs or something else, get blackout curtains to help with those sleep quality concerns.
Great. So, okay, so we talked about what doctors and therapists should be asking their patients about sleep, things to assess for. How about the other way around? So for any women who are listening to this video who are struggling with sleep or want to optimize their sleep, what kinds of things should they be asking their healthcare practitioners about?
Yeah. So first of all, talk to your practitioner about your sleep. Bring it up because it may not come up naturally, or they may not be able to ask you, or even have a reason to ask. Ask them if there are concerns about your sleep quality or about your daytime quality of life. Ask them how to improve your sleep quality, how to improve any symptoms that you may be having, either with difficulty falling asleep, staying asleep, like insomnia or others that we've already discussed. Ask them if you need to see a sleep medicine specialist, or if you have concerns about sleep that could be related to a specific sleep disorder. Ask your doctor if there's anything else that could be causing your concerns or your sleep issues, like sleep apnea or restless leg syndrome.
Great. So all really helpful. So if people want to work with you, where can they find out more about you and your practice?
Sure. So our practice is Sleepology Health and Wellness. We are in Chicago. We see patients virtually and in person. We're located in Lincoln Park. And we take insurance, so insurance-based practice. We have a website. It's sleepologydoc.com. So sleepology with a O-G-I-E instead of O-G-Y. So sleepologydoc.com. You can call the office and make an appointment if you're in the local area. We'd love to see you.
Great. Well, thanks, Dr. Raina. This was super informative. And if people have questions or you just want to share what you learned from this video, go ahead and put that in the comments below the video. And again, we're doing a sleep summit on March 4th and 5th. It's called The Power of Rest. And it's all about how a well-rested woman can change the world. And our mission really, you and I and our 6 other colleagues, there's 8 of us total, is to really spread the word about women's sleep health. So we'll put the link to sign up in the video description again, and then on the screen here.
Great, thank you.
This channel is all about sleep education for physicians and therapists. So go ahead and subscribe to this channel if you're interested in learning more about how to help your patients with sleep. And then also click the like button if this type of information is helpful for you, because doing so is going to get these videos and this information out to more healthcare practitioners so we can all support our patients with the power of restorative sleep.